Ladies and gentlemen, a topic that is super controversial. Most people are told to drop red meat because it's going to cause you gout. It's going to cause you accumulation of uric acid that will precipitate in your joints, causing you those painful and inflamed joints. It's a lie. I'm going to talk to you about gout. I have done this before, but allow me to explain it over and over so that you get to understand it. What is gout? Gout is a common form of arthritis. From the statement, you should understand it's actually a type of arthritis. So when we are talking about arthritis, you should understand that that's actually capturing gout, okay? Because it's actually called gouty arthritis. So it's a type of arthritis that is characterized by recurrent attacks of joint pains. Now, these joint pains will happen mostly in the extremities, the toes, the fingers, and then it starts coming up into the knees, the ankles, and all that. It spreads all over. And this pain is very specific. Sometimes, not actually sometimes, most times when it's cold, that's when you experience a lot of these pains. Why? Because cold temperatures, they exacerbate the problem and they actually cause or activate the conversion of uric acid into urate crystals and then the deposition of these urate crystals into the joint, causing you the pain. So you'll get this when it's cold, and that's why most people suffer these pains at night. And then sometimes this uric acid or these urate crystals can precipitate under the skin and form something that we call atophy. It is not painful, but it can actually block the joint movement. It can actually inhibit the joint movement. It looks very ugly on your skin, so you can actually check out how atophies look. And then this painful joints and inflammation in the joints can actually lead to osteoarthritis. Okay? All right. And again, I want you to note that when you're sending this crystal or these urate crystals into the joints and all over the system, even under the skin, some of these crystals can actually get into the kidneys and they react, causing the urate stones that will block flow of urine from the kidneys. They can actually cause a lot of problems with the kidneys in terms of urate stones, and also they can cause obstruction and infections of the kidneys. Sometimes even in the bladder, they can cause the bladder infections. Okay, so this is basically what gout is. But I'm going to take you through these stories so that you can actually understand the entire picture. So look at it this way. Where are we getting the uric acid from? This is where the doctors or your practitioners will tell you to avoid red meat because they only believe or think, just like the syllabus, that uric acid is only coming from the consumption of meats that are going to give you purines. So look at it this way. Uric acid is a metabolite of things called purines. Where do we find purines? Yes, we find purines from red meat. We find purines from seafoods. We find purines from fruits. Did you know that? Fruits come with purines, and I will explain to you that. Purines come from alcohol, specifically beers. Purines come from table sugar that has fructose and also has glucose. Purines come from the sodas and energy drinks that we take all the time. Purines come from high-corn fructose syrup that is present in most of your processed foods. Look at the label, you'll see high-corn fructose syrup. That is fructose. Purine comes from honey. And this honey, the high-corn fructose syrup, the energy drinks, the table sugar, the fruits, they cause production of uric acid in a very different way. Of course, they might not have purines directly, but they cause production of these purines, and they also cause production of uric acid in a very unique way that we'll talk about. But most importantly, purines, the larger percentage of purines come in from turnover of proteins in the system. So proteins that are made up from DNA and RNA. When you do the turnover of this DNA in the cells, we get purines. When you're fasting, you're busy destroying the cells through autophagy, the cells that are dead, the debris and the proteins in the tissues being used for energy. You're also turning over a lot of DNA that forms you the purines. When you're eating the seafoods, when you're drinking alcohol, you're getting a lot of purines. When there is a lot of cell turnover, maybe injuries and infections, there's a lot of purines being produced. And that's why pus is high in purines. And purines can serve as food to microorganisms. That's why when you're using antibiotics for any wound, you must drain the pus before using that antibiotic. Because these purines that are coming from the pus, they are very good foods and substrate for making DNA for the bacteria. And then protein consumption, the red meats, the white meats, all of them are actually going to give you purine. So these are the sources of purines and different ways how purine comes into the system. Specifically these ones, there are ways that bring high purines in the system, and these ones are the sources of purines in the system. Now, The breakdown of purines or metabolism of purines is the one that will yield you uric acid. So when you're busy breaking down or metabolizing purines, your end result is coming to be uric acid. Now this uric acid is now released into the bloodstream. And in blood, of course, all of us have uric acid in blood. But in blood, when you're now bringing in a lot of uric acid, the levels of uric acid start going up. And when they're going up, that is what we call hyperuricemia. Okay? And when you have high uric acid in this blood, that will now be deposited somewhere, because remember, we have two channels. First channel is we have to take this uric acid into the kidneys, and then it's excreted out through urine. But number two, excess of it can be crystallized into urate crystals, and they are sent into the joints to start causing you problems. So that precipitate of urate crystals in the joints is the one that gives you gouty arthritis and that painful and inflamed joints. But I want you to see this, that the production of purines or of uric acid has never been the problem. If any case, an increase of the production of uric acid is the least on the causes of gout. And this is the point. Uric acid or gout is not an intake problem. It is an exit problem. The major cause of gout is a challenge in excretion of uric acid from the system. So your exit is now blocked. Once it's blocked, you start having accumulation of uric acid. And now the body thinks, where should I take this? It sends it into the joints, and that causes you a lot of problems. So uric acid is not an intake problem. So when somebody tells you to stop eating red meat, please ask them, how about this? Because these are also sources of this. How about the protein turnover? How about fasting? When I fast, I have high uric acid. Will it cause me a problem? Of course, they will tell you, yes, fasting will cause you a problem. But you know very well, fasting comes in handy to actually help you heal. So the problem is not how much you're taking in. It is about how much or the efficiency of excretion. That lies in the kidney problem. When you understand that lies in the kidney problem, you will know kidney problems are sugar problems. Those things that destroy the kidneys are the ones that actually cause an increase in uric acid. So we have three causes or three reasons why we have high uric acid in blood that will be precipitated in joints, cause you gouty arthritis. One is increased production of urate crystals or increased production of uric acid. How does this happen? Obesity precipitates this. Obesity actually activates this conversion of uric acid into urate crystals, and cellular death, turnover of cells, is where we are getting our purines that will be converted to uric acid, and now you have problems. That is a minor pathway of getting gout. The second pathway is overconsumption of purines. This is where doctors put their notes on. Overconsumption is actually coming in from red meats, coming in from alcohol, coming in from yeast, coming in from these products that we just talked about here, which are bringing in either fructose or bringing in purines directly. And then the major pathway that causes us gout is reduced excretion of uric acid from the system. Reduced excretion of uric acid from the system, not the production and not the overconsumption, because the body has its own mechanisms of regulating excess. Okay, so you can never get into overconsumption or excess in the system unless we have a problem with the exit, and the exit is the kidneys and urine. Now, what causes this problem? There are people who are hereditary. They have an inherent way of not excreting uric acid through the kidneys. That is a very minor population. About 2 to 5% of the population have inherited the inability to excrete uric acid from the system. But kidney disease is actually a symptom of sugars in the system. Diabetes, hypertension, all those, even cancers, medications, all of them are going to cause you problems with the kidneys. Heavy metals, alcohol consumption, these things are causing you problems with the kidney. So therefore, kidney disease, which is coming in, we have hereditary issues, we have alcohol consumption and cigarette smoking, of course. We have heavy metal poisoning like lead, mercury, and arsenic. We also have medicines like diuretics and cancer medication, and even drugs for TB and some antibiotics. I've told you about gentamicin and how it destroys your kidneys. So once you have a kidney problem through these mechanisms, you are unable to excrete excess uric acid. Now you start building the uric acid in the system, and now the body sends it into the joints to cause you problems. So please stop thinking that eating red meat is a problem. I have had a lot of clients who were stopped from eating red meat for over 3 to 5 years or so, but they still suffer from the same condition. So it's time to ask your doctor, sir, you've told me, or madam, you've told me to stop eating meat for 2 years. How is it possible that 2 years down the line, I still have my gout? I still have a lot of pain. How is it possible? I thought when I stop the red meat, gout is supposed to disappear. Why have I stopped red meat and you still put me on medication? I thought if you stop me from taking the red meat, I'm supposed not to take medication because that's where the uric acid is coming from. So if I stop it, it's gone. Why are you putting me on medication? And it's 2 years down the line, I'm still taking the same medication. But anytime I go for a checkup, my uric acid levels are super high. Because you drop red meat and you still have uric acid because of the problems that are coming with seafoods, that are coming with fruits, that are coming with alcohol, table sugar, soda and energy drinks, and honey. And you will realize these people drop red meat, but they're still consuming these things. They're still even consuming the inflammatory foods, the seed oils, the wheat products. How? So we want to coat these. We want to actually make sure we protect the food industries and the pharmaceutical companies as we make you suffer and as we extract money from your pocket slowly but in a careful way. Please, let's run away from that. So let me explain this. When you consume fruits, honey, high corn fructose syrup, what else? The energy drinks, the sodas, all of them come with fructose. Fructose is a very skinny sugar. It's a sugar that does not cause you problems in terms of increasing blood glucose levels. However, fructose is converted to triglycerides in the liver. Those are fats. And these triglycerides are now ferried into the system and stored in the fat cells. As they do that, we start having a fatty liver because some of it accumulates in the liver. And that gives you a fatty liver disease, the non-alcoholic fatty liver disease. Basically, a dietary fatty liver disease. A fatty liver is responsible because remember, we have now a fatty liver and also we have obesity as a result of pumping all these triglycerides into the fat cells to add you weight. So we have two tragedies, obesity and a fatty liver. And once you have those, a fatty liver and obesity are the mothers to insulin resistance. Insulin resistance is the mother to kidney disease, underline that word, kidney disease, heart failure, strokes, coronary heart disease, which is basically heart disease. We also have peripheral vascular diseases. All these are coming in as a result of the fructose that you consumed. Excessive consumption of the fruits, the honey, the processed foods, the energy drinks, the soda, the sugarcane. All of them are bringing in fructose that is going to cause you an insulin resistance that's going to give you a kidney disease or kidney failure. Now, when you have a kidney problem, you are unable to excrete excess uric acid. So it starts to build up. Second tragedy, fructose is broken down by an enzyme called fructose kinase. But this enzyme or this process activates another enzyme that is called adenosine monophosphate deaminase. This is an enzyme that converts the fructose into uric acid. So look at it this way. One, the longer channel has given you a kidney problem, impairment of the kidneys, so therefore impairment in excretion. And the other one is giving you uric acid. So you start increasing the uric acid amounts because you cannot excrete it from the system through the kidneys. They are already failing. Now you have gout, because all this will be sent into the joints to crystallize and to give you gouty arthritis. So therefore, if you're eating fruits and you have gout, problems. If you're taking processed foods and you have gout, problems. If you're consuming sugarcane, hoping that sugarcane and honey are natural sugars, problems to people who have gout. Okay? Because it will actually keep you in that state. So imagine dropping red meat only, and you still use seed oils, you still eat wheat, you're still consuming all these processed foods and the sodas and the juices, and you're thinking that you're safe. No wonder you've always been on those drugs and nothing is happening. No wonder when you go back, the checkup, your toes are always just turning and being deformed. No wonder your uric acid levels are always going up, even if you're on drugs. And now there will be a change of medicine. There will be an increase of dosage of the medicine, but nothing is happening and nobody is telling you the truth. So meat has never been the problem. Why? Because meat is just part of the purines, yeah, the source of purines. But meat does not affect kidney function. So meat does not cause you a kidney failure. So even if you eat meat in excess, let's say it that way, you still have the kidneys to excrete excess of it. Okay, excess of the uric acid will be excreted out. But if you eat fruits, you are actually increasing uric acid and blocking the exits. And remember, the major cause of an increased uric acid in blood is actually an excretion problem and not a production or an intake problem. Please note that, okay? So fructose is a very dangerous sugar, and it's actually so if you drop just fruits, you drop the processed foods, you drop the table sugar because it has fructose and glucose, you drop the natural sugars, the honeys and all that, and eat your meat, you'll be okay. But you drop the meat and continue eating the rest, you will suffer the consequences, and that will take you to drugs for gout. And what are the drugs? We have drugs that manage symptoms of gout. which most of you are using, the non-steroidal anti-inflammatory drugs or the painkillers, and the steroids. Okay, when you have joint pains, you inject Diprofos in your joint to manage the pain. You take diclofenac injection or diclofenac tablets, the NSAIDs. You take meloxicam, aceclofenac, celecoxib, all of them are NSAIDs. Or you take prednisolone, methylprednisolone, dexamethasone, those are the steroids. Okay, they manage the symptoms. So your disease will still be there because you're feeding it, but the symptoms are managed. Because when you just get a relief from pain, you keep on eating what you're eating because you know, anyway, if the pain comes back, I'll go back. And then they'll tell you it's a chronic condition that you only manage the symptoms. It's a lie. You can actually recover from gout and gouty arthritis. And then we have drugs that actually reduce the production of urate or uric acid. Now, reducing the production of uric acid, again, it doesn't make sense because a lot of it is coming in from the turnover of cells and the DNA and the purines in the system, internal turnover. Okay, so reducing the production of inside is stopping a biological function. You rather stop bringing it in. Anyway, we have allopurinol and we have febuxostat. Those are drugs that actually reduce the production of uric acid, the mode of action. Number three, of course, they have enzymes that they act on to produce the production of uric acid, but we'll not go into that. Number three, we have drugs that increase the excretion of uric acid. But the challenge is coming in here. By the time you're getting to this increase in uric acid, it means your kidneys are actually failing. So now you're activating failing kidneys to excrete excess of the uric acid. Does it make sense to you? We are going to wear down the kidneys. So this is the point. Drugs like probenecid are the ones that are used to increase the excretion of uric acid. But the point is, why do we have to go all this route of medication which will not treat the cause? And the cause is a messed up kidney. And the cause is basically sugars. So why don't we stop the sugars to actually help you now rejuvenate your kidneys, and now you can be able to excrete excess of the uric acid and the levels go back to normal. It is easier that way. But again, this is not to substitute your doctor's advice. This is a choice you can actually make and see what happens to you. So if you are somebody who is suffering from gouty arthritis or any type of arthritis, try dropping sugar in all forms, including fruits and honey. Try dropping the inflammatory foods, the sugar, the wheat, and the seed oils. Try dropping the energy drinks and processed foods, all of them. Try dropping the natural sugars in form of honey and sugarcane and the fruits. Okay? Try dropping the alcohol. Some of you go to the bar and you eat meat and then you drink alcohol. You've taken in a lot of purines, both from the meat and the alcohol, and you've also seen that alcohol blocks the excretion of uric acid. So now you'll blame the meat and defend the alcohol. That doesn't make sense because you stop eating meat, but you're still in a bar drinking alcohol. You're still eating fruits and honey, using seed oils, and then you blame it on meat. Eat meat, eat it in plenty, and make it fatty. Okay? And thank me later. So this is gout, and this is basically the mechanism of gout and the drugs for gout plus their mode of action. I'm trying to make things easier for students and also people who don't understand this. So I hope I've broken it down in a language that you can easily understand, and why fructose is very dangerous to your joints and to your uric levels in blood.